Kenya is home to a population of over 43,500,000 people. It is found to be one of the most diverse countries found in the world, with over 40 different ethnic groups and various indigenous languages. With the country's tropical and temperate climate, agriculture is a huge part of the Kenyan economy. Kenya's primary agricultural products consist of tea, coffee, corn, wheat, sugarcane, and many others. Even though it seems as though Kenya should be a prosperous country with a thriving economy, there has been one major obstacle in the way of the struggling country: the deadly HIV/AIDS virus. Did you know that an estimated 1.6 million people are living with HIV in Kenya right now? 1.1 million children have been orphaned by AIDS, and in 2011, nearly 62,000 people died of AIDS in Kenya. Kenya is the home of the HIV and AIDS pandemics, ranking the fourth country in the world with the highest number of people living with the HIV/AIDS virus. Although the HIV/AIDS virus has become a colossal pandemic, the first case had only been reported in 1983, where it had been found in a group of sex workers in the capital of Kenya, Nairobi. By the end of 1986, 4 cases of HIV were being reported each month. In an effort to stop the problem before it arose, the Kenyan government decided to publish informative articles urging people to use condoms and avoid indiscriminate sex. To their dismay, by 1987, HIV had spread even more vigorously, contributing to a 1 to 2% of Nairobi's population. And by 1994, an estimated 100,000 people had already died from AIDS, and 1 in 10 adults were infected with HIV. The pandemic continued to spread into a predicament that even the government found too difficult to handle. Since the issue had been recognized, the government had worked at correcting and promoting prevention of the virus throughout the country. One of the efforts for prevention has been HIV testing. With easy access to HIV testing, people are aware if they are infected more quickly. In 2000, there were only 3 voluntary counseling and testing VCT sites nationwide. By 2010, there were 4,438. Alongside voluntary testing, provider-initiated counseling and testing, PCT, has expanded and is now available in 73% of health facilities. PCT is when individuals are offered a HIV test whenever they go to a health facility, rather than patients having to ask for a test. However, increased rates of testing do not always accurately reflect an increased number of people who know their status. This is because people may have become infected after an earlier negative test or may not have received the results. Another effort for prevention has been the promotion of condom use. The Kenyan government has only actively promoted condom use since 2001, when an estimated 12.8% of its population was infected with HIV. That year, the government announced its intention to import 300 million condoms. Since then, condom distribution has been radically scaled up. 10 million were distributed in 2004 and 124.5 million in 2008. However, there have been a number of obstacles either preventing people from accessing condoms or preventing people from wanting to use them. In particular, Kenyans have often received conflicting messages about condom use. Many religious leaders have expressed opposition to condom use. For instance, the First Lady of Kenya had stated, "I am not telling you to use condoms, I am not in favor of condoms." Of course, education and awareness have been prominent ways for prevention of AIDS in Kenya. Additionally, preventing mother-to-child transmission, PMTCT, has grown over the years. Since 2000, PMTCT efforts in Kenya have rapidly expanded. There are now more than 3,397 health facilities offering PMTCT services. In 2011, an estimated 67% of pregnant women living with HIV received the most effective antiviral regimen for preventing the transmission of HIV to their babies. The treatment of the HIV/AIDS virus is far from simple. In 2003, only 5% of people needing treatment were receiving antiviral therapy, a form of medication used for HIV and AIDS to slow down the progression of the virus. In 2006, Kenya's president announced that antiviral drugs would be provided for free in public hospitals and health centers. By 2009, the number of people receiving antiviral therapy had significantly increased to 336,980. Adequate nutrition for people living with HIV is essential. Yet, as poverty levels are high in Kenya and food shortages frequent, people living with HIV are often unable to eat a healthy, balanced diet. Evidence shows that malnourished people are less likely to benefit from antiviral treatment and are at a higher risk of quicker progression to AIDS. In addition, taking treatment without food can be very painful. In recent years, various studies have confirmed that HIV prevalence is associated with specific groups, including sex workers, injecting drug users, homosexuals, truck drivers, and cross-border mobile populations. Additionally, women are much more largely affected by the virus, considering that only 4.3% of men are infected compared to 8% of women. Even though awareness of HIV and AIDS in Kenya is high, many people living with the virus still face stigma and discrimination. Studies have shown that although people are aware of the basic facts about HIV and AIDS, many do not have the more in-depth knowledge that addresses issues of stigma. With 16% of people living with HIV in Kenya reporting having felt suicidal, social stigma of HIV is an urgent issue. Even though Kenya is an ocean away, there's still a lot we can do to help them with the AIDS pandemic. Anyone can join an organization such as KANCO or WOFAK. These organizations work in Kenya to make the conditions of people living with the HIV/AIDS virus much better. You can contribute to the organization by simply making a small donation or even making awareness of the problem in your community. These are all easy steps to make a huge difference not only in your community or Kenya, but the whole world.